I think the RHN meeting this year has been very interesting because it's been held in conjunction with the European Public Health Conference. And that does two things, I think. On the one hand, it puts people into a much bigger context where the regions can see how public health is a Europe-wide issue, where they're a component. But at the same time, I think it also accentuates the fact that the Regions for Health network has got a particular role in the family of people trying to improve health in Wales. People who come from the regions understand that their job, being between, as it were, local administration and communities and families and national governments, forms a very important level where lots of political decisions are made in practice and lots of policies are formulated which have an impact on people and their communities. I've been involved with the RHN since its beginnings in the early 1990s, and that was a time, soon after the wall came down, that there was a feeling of openness in Europe, a feeling of change in Europe. And a number of regions within countries came together to think about what they could do to react to respond to the World Health Organization policy at that time called Health for All. And I think it was a very interesting policy because it was a policy which said health is not just about health services, but it's about how we live our lives, where we work, who our friends are, how our communities work. And regions came together to work together, to share ideas, to talk about the challenges they faced. So it's been in existence for 20 years. But I think we're at a new phase here because I think that the organisation of the network with WHO is taking a new, slightly more professional approach, and I think that is very helpful, and I think we have an enthusiasm in the network at the moment which promises well for the future. I think there's a double challenge. One challenge is austerity is actually reducing the amount of money available for public services. And therefore health services are under pressure at the same time when people are facing poverty and challenges in their own lives. And so in a sense, health problems are likely to be increasing, not helped of course by an ageing community, even though most people are actually very healthy. And the combination of the health challenges and the difficulty in finding resources puts a particular challenge to health systems, I think.